You and I both know that veterinary medicine is very slow to evolve, right? How much pushback are you getting now compared to when you started this entire cannabis education for veterinarians? CBD is everywhere. It's in treats, it's in oils, it's in topicals, it's in everything. How much of it is hype and how much of it is science? Just for all the veterinarians listening out there, can you give us a very simple way to explain the difference between cannabis and hemp to an owner? True, false. You need at least a little bit of THC in the product for CBD to be absorbed. This is a smart ass question. If I take the THC with a snack, will it keep me from wanting more snacks later on?
Cannabis, because it's working on that endocannabinoid system and helping the body regulate itself, is a beautiful modality to use for behavior cases. This is not a field that we have a choice about. From veterinary medicine perspective, it's already here, and we are kind of already behind in terms of us knowing how to respond, because these medicines work very, very differently than cannabis or some of our other drugs, and the effects last much longer than that exposure time window. We actually see some opening of critical learning periods that can stay open for several weeks after the exposure. So it's not just about the intoxication phase, it's about what happens in that animal's neurologic circuitry after the fact.
Welcome back to Irreplaceable Truths, the podcast where we strip away the noise and get to the raw realities of shaping veterinary medicine. Today's episode dives into a subject wrapped in hype, controversy, and hope. Cannabis for animals. CBD treats are everywhere, but how much is science, how much is marketing, and where does the truth really lie? My guest, Dr. Andre, is just talking about cannabis. She's leading the way educating veterinarians and pet families, co-authoring critical scientific reviews, and pushing this conversation into clinical mainstream. So let's cut through the smoke, you like that pun? Literally, and get to irreplaceable truths. How you doing, Dr. Andre?
I am having a beautiful day and excited for this conversation. Thank you so much. What a great intro. I love all the cannabis puns throughout there. Well done.
Well, I am in SoCal, and where the studio where I record is actually, they call it the Costa Mesa Greenbelt, and 85% of the industrial complex are manufacturers and actually PhDs and also patent holders. It is crazy. The amount of knowledge that is in here, and I really worry about the cannabis industry because it's just like the veterinary industry, very fragmented. I don't think any of these companies really know what the other companies are doing. Very secretive. So that's why we hope to shed a light, especially on cannabis in veterinary medicine, because I've seen the benefits in human medicine, especially with my mom that was going through cancer and chemo treatment and hospice and everything else. So I think it's something that needs to be brought to the forefront. Let's start really quick. Your bio. Let's start with your bio. Where did you go to veterinary school?
I am a graduate of the Virginia, Maryland Regional College of Veterinary Medicine. So Virginia Tech was the school. I had such a fun time there. I grew up in Texas, so the chance to enjoy 4 seasons in Virginia was very fun during vet school.
Yeah. So were you at Virginia Tech itself, or were you at the campus in DC?
No, I was at Virginia Tech itself. Blacksburg, Virginia.
Yeah, so you're in the middle of all those mountains. Yeah, all those mountains. I mean, anyone who's driven to Virginia Tech, it's so awesome. You go up these mountains, and all of a sudden you come down and you look to your right, and there's this valley, and all you see is Virginia Tech. It is unbelievable. What the hell's a Hokie?
Absolutely spectacular. That's a great question. And one we talked about a lot at the veterinary school. What is this bird? For anyone who doesn't know, it's a mascot of Virginia Tech. My biggest memory of that is I worked in the ClinPath lab. So after hours would run all the blood work and chemistries for the hospital. And there was always someone from the football game in my parking spot. And there was always someone in this bird costume. It's like, what is happening here? So I never had too much love for the Hokies.
Well, rumor has it it's a castrated rooster.
Yep, that's what the saying is.
Yeah, no, Virginia Tech Blacksburg is absolutely incredible. I got the I was on, I was a swimmer in undergrad, so we got to go there. And I absolutely loved it every single time I went there. I didn't have the brains to get in there. Um, big time STEM school, very impressive. So then if I remember correctly, then you went military, correct?
Um, what was your question? Can you re-ask me again?
You served in the U.S. Army Veterinary Corps, if I'm not mistaken.
Yes, you are absolutely correct. So I commissioned in my second year of veterinary school. A lot of people are familiar with ROTC, and so that's the scholarship program for undergrad. Health Professional Scholarship Program, so the HPSP, is for graduate school. So for DOs, optometrists, any of that, veterinarians, it's the way that you can go through graduate school, but paid for by the military. So I commissioned in my second year, and then actually had a lot of support from that. My academic affairs advisor was a retired colonel. The community class instructor was a lieutenant colonel in the reserve. So I had a lot of mentors in that area too.
How did that help shape you for practice?
Definitely helped shape me for practice. I decided pretty early on that I wasn't looking for a really traditional vaccine focused clinic, preventative medicine focused clinic. And with some of those mentors that I had around me, I was really interested from the beginning in some of the atypical paths that we could take in veterinary medicine. And so military service was something that really stood out as interesting, had a lot of different paths that you could pursue even within that. So I was really interested in the working dog aspect and some of the very specific sporting dog medicine that goes along with that, as well as some of the just team structure, leadership concepts that come from serving in the military. So those were the things that drew me there originally.
Iditarod?
Yeah, so I did the Iditarod while I was in the military. So after veterinary school, I was on a break between some duty sites, and the Iditarod, you actually have to work your way up. You have to serve in a couple of other races before you can serve as a veterinarian in the Iditarod. But because I had my working dog experience from the military, I was able to kind of jump right into that. Such an amazing experience. So I was a trail veterinarian in 2015 for the Iditarod. And essentially that means that you're at the check-in point. So as the dogs race along, there are particular points that they might get more injured because of the long stretch or the terrain. So check-in, there's always a veterinarian there, checks on each of the dogs. Handlers kind of get themselves reset. Sometimes there's a night of rest. So we would always leapfrog over the teams. We would get to fly in these little bush planes and then go ahead of the teams and be able to meet them there, be ready for the vet checks. So cold, like -60. It was crazy. I have some pictures of my stethoscope, like me holding my stethoscope, and it's frozen straight out. So it's like a rod. And most of the newbies, I avoided this, fortunately, ended up with frostbite in their ears, because if you don't warm up
Wow.
the tips of your stethoscope and you put it in your ears, like, you'll definitely get frostbite here. I for sure came back with some cold injury in my hands. I was already practicing, and I could tell when I came back and was doing some surgeries, I definitely had received some cold injury, because you're doing exams on the dogs after they've run in the ice for miles. And so you're trying to do like an orthopedic exam while you're holding like this leg that has icicles frozen into all their tail and feet. So it was an experience, but such an amazing one for sure.
What was the average resting heart rate of one of those dogs?
Uh, 60 probably. I mean, they were such
Wow.
athletes. I mean, you
Yeah.
see, you see a really interesting breed kind of in that sport, and they're not your typical purebred. It's not like it's a husky and they're all huskies. It's this very hybrid vigor collection of dogs, and they're just extreme athletes and really love the job, love to work, love to run. But there's some really interesting things from a medicine perspective, orthopedic for sure. But GI was also something that I learned a lot about. They have to consume so many calories to even maintain weight throughout the race, that not every animal can consume that many calories in a short period of time and process it well. And it was something that I haven't really ever thought about, but just GI capacity was almost as important as musculoskeletal issues. Isn't that fascinating? It was not something that I had encountered before, but that
it's
type of
yeah,
work.
it's crazy. It's crazy. And you're in Colorado now. Isn't there Iditarod training in Colorado? Like I could have sworn that one of my clients moved to Colorado with all his huskies, not because he was going to do Iditarod, but he was going to do Iditarod type races in the Rockies.
I can imagine that being the case. I don't know any of those groups myself, but we have a lot of athletes that come and train here. There's an Olympic training center just because they're training in high altitude. There are definitely a lot of dog teams that run their own races or do tourist events here up in some of the mountain country. So I can absolutely imagine that someone came here to train before the Iditarod.
That is crazy. Well, yeah, I don't think he was. Trust me, he was not ready for the Iditarod. The dogs might have been, but he was not. He was a Southern California guy that just started rescuing us.
So he was training. It wasn't so much for his dog team. It was more he was conditioning for the Iditarod. It was really interesting to interface with the mushers. They bring their own aspect to the sport. In the military, working with the handler as well as the dog is a really big piece of that type of medicine, of figuring out the partnership as well as the medicine for the actual animal. And so working with packs is very different than a partner dog in the military type setting. And such an interesting thing to interface with as a practitioner. The dogs are very handleable. They're used to being put into planes by all these different people. Like, they're very, very well socialized, but they always have an eye to their lead, the pack lead and the musher. So it's this really interesting triangle of interaction when you're doing anything medicine related versus in the military with a partner dog. You're very much feeling that bond between the dog and the handler. Does that make sense? It was really interesting to interface with that as a practitioner.
Well, you truly see the hierarchy because dogs are pack animals, and so there always is a hierarchy. Most of the time, it's supposed to be the human that's in charge, but most of the time it is not, as you and I know. But it's funny when you compare it to a cat, because cats think they should take over the world. There's no hierarchy in cats.
It's just a known truth there for that one, right?
Would you say the Iditarod's what really made you start thinking about integrative type medicine?
Earlier than that, even in my initial first duty sites, first working with some of the kennels that I was in charge of, I felt really early on that I was missing a part of my medicine. And I think that'll make sense just as colleagues. It's you know when you can go into a case and you at least have your footing. You might not know all the details, but you know where to look it up. You know which specialist you're going to call, you know which friend you're going to tag. And I just always felt that I was missing the really true sport medicine side, especially for military working dogs. We know all of them, their life history. We either bred them ourselves or purchased them from a known kennel, and there's no surprises. You don't suddenly have heart disease or suddenly have renal disease. You see all of this coming because of the really intense medical care they receive. So the things that you see are either very dramatic, like I impaled myself on the training field, or I thought it was a good idea to jump on this ladder, or the training injuries that are more strains, sprains, GI upset, a hard training day, heat injury. And I just always felt that my medicine in that, I'm going to use the term softer arena, just where the body's still resilient, the body still has the resources it needs, but it's being stressed. It's right near that edge of fatigue. I didn't feel like I had really good ways to support my patient or their handler in preventing that injury down the road. And so that's really what got me into integrative medicine, was looking for that thing that I felt I was missing when I was really working with these sporting animals that had really, really high quality of life, vitality, but they worked really hard. And there was a piece that I didn't have to support them. So that's definitely what started me on the journey. But I also recognized it in the Iditarod, really wanting to give a different piece to those animals. Now, the Iditarod, because it's a race, is pretty strictly controlled. So if one dog, the rule is no dog can receive it if the others can't have it. So you weren't able to do like a chiropractic adjustment to one dog because that would have changed their maybe likelihood of success. So it was very much a screening, preventative medicine role for the veterinarians in the Iditarod.
When did you get your certification in veterinary acupuncture?
Ooh, that's a good question. 2012, 2013, something along those lines. So I transitioned from the active side of military to the reserves and moved to Colorado and taught ROTC for a while in Boulder. And so it was just then when I was transitioning between active and reserve and was beginning some of my own businesses while I was in the reserve, kind of had just a little bit more flexibility, that I really started pursuing some of the certifications. I also did the rehab course through Tennessee, which I never actually finished that one, but I was able to do some of my internship at the Lackland Air Force Base, which is the referral center that we send all the working dogs to. So I got to see a lot of their rehab, sport medicine, but also rehab from like heat injury. So that was fascinating. And so right when that transition for me from active to reserve, I feel like I had the opportunity to pull in a lot of those other certifications or ideas that I wanted to follow.
Because Tennessee is the largest veterinary rehab certification program, if I'm not mistaken, correct?
Yes, and I believe the first one. There is another one now whose name escapes me at the moment, and I hear really good things about the curriculum, although I can't remember which school is doing it. But I believe Tennessee's the first one, and it was definitely the one that was available to me kind of at that time. Definitely enjoyed the course. Went all the way through the internship, and then just didn't do the exam part because then I was into kind of my own businesses and doing the acupuncture side. So nice to have the knowledge, but I didn't feel that I needed to finish the certification because I wasn't going that direction too heavily.
So you finished that EBE, everything but exam.
I've never heard that acronym, but that sounds like a very true one. Yes, exactly.
Well, no, it happens to people going through residencies. It happens to people going through doctoral programs.
Yeah,
It's
that makes sense.
it's EBD, everything but dissertation.
Yeah.
Yeah,
Yeah.
life happens, and people have to realize that life happens. And that's, I think, one of the biggest issues we deal with in veterinary medicine is that they're shooting for this perfection type thing, and they
Yeah.
don't realize, no, every day is a different day, and it's not going to be the same cookie cutter type thing, especially in practice.
Absolutely. And the industry around us is changing. The world around us is changing. Our patients are adapting and flexing to what's going on in around them as well. So veterinary medicine is absolutely art of adaptability because we are enmeshed with the world that our client exists in as well.
So as you were diving into integrative medicine, when did cannabis become one of your, like that I realize how important cannabis can be for the veterinary world?
2014 and 2016, when Colorado started to change its cannabis policies, I, along with all of my Colorado colleagues, were like, what is happening here? What is going on? We don't understand what this molecule is. And like with any substance that humans are interested in, we just see that spill over into animals. Unintentional ingestion, intentional ingestion. The owner is trying to share something with the animals, malicious ingestion. And, I'm still practicing in Colorado, so we're sort of going through the same thing on the psychedelic medicine side, and it's pretty much exactly the same. So looking back on the cannabis journey was really when the families around us, the areas around us started to be curious about cannabis, and animals absolutely were affected. So as practitioners, we just decided we need to do something. At the time, I was running my co-working community, and that's still a feature of my business ecosystem, Cultivate Wellbeing. And so I had the privilege of listening to all the practitioners who are working in that co-working ecosystem. They were doing hospice, palliative care, senior care, acupuncture in home, rehab in home. And so everyone was having the same issues. What is this? What are my clients giving to my dog? Like, what is going on? What should we do? And so because I was running the co-working group, I had the privilege of just hearing everyone and really consolidating all that information. And then we learned to do that at a global scale. And we're just the consolidators of a lot of global information. And that's still what veterinary cannabis is today, is listening really closely to what's going on and putting that into medical and scientific context so that we as practitioners and as pet parents know how to cut through the hype. Like you said in your intro, to really be able to have the tools that you need to critically assess what's being said from the brand side, because it is an interesting field to work in. No lie there.
Don't worry, we'll get there. I will get there on. Can you remember the first case where you thought, hey, cannabis could really help this animal?
Yes, I absolutely can. It was my own cat. Shocker. Are you surprised at all that that's what I say? My own cat's name was Maddie. She was definitely my heart cat. She was the one I went through veterinary school with. You know exactly what I mean. Just that animal that sees you through that section of life. Had IBD since she was a kitten, like just was always part of her presentation. She was 17, really struggling, did not really have any good pain control options for her that worked for her GI, still struggling with IBD. And I heard a lecture on a hemp product. And also at the time, a friend, their father was going through some pretty significant cancer issues, and they had asked me to help research medical marijuana for him. And so, of course, I researched it for my own cat as well. And so she was the first animal that I ever put on a hemp-based product, which for our audience is a CBD dominant product. That's the molecule that it has as the most concentration of. And just saw a dramatic difference. And I worked with her with hemp products and marijuana products. But the last 2 years of her life were beautiful. And I'm so grateful for those. And as I say a lot, she now teaches the world about cannabis. I built the brand for her. I started out because she needed something. And then we continue to teach a pretty similar curriculum because a little kitty needed some GI support in Colorado. I mean, how cool is that we just shape the world for the animals that need it?
Well, well, you know, you and I both know that veterinary medicine is very slow to evolve, right? How much pushback are you getting now compared to when you started this entire cannabis education for veterinarians?
That's a great question. We serve globally, so it is always kind of the same adventure when a new country opens up their cannabis policies. For example, Brazil just legalized their veterinary cannabis, or let me say that differently. They just have finally put in place policies that allow that veterinary component to take place. Cannabis has been there for a while. And so you see it almost begin the same scenario again. You see brands come in, kind of try to find where they have a fit, what their niche is. The practitioners reach out with the same questions. So I would actually say that I think we experience that same trajectory of growth with every country that opens up and every new set of students that come in. But if I just speak about Colorado, almost every pet has been exposed to cannabis of some form. You can buy a CBD isolate from the gas station. So really now it's more a question of, when was this pet exposed? What was their reaction to it? And are they currently receiving one that I don't know about? It's more that last question of, they're probably getting some form of cannabis, and I as a practitioner need to know that and how it affects my other drug dosages, versus in the beginning, fewer people would tell you that they were using it, and it was a little bit more from that stigma side of getting the information out of the pet parent.
Well, as you said, CBD is everywhere. It's in treats,
Mm-hmm.
it's in oils, it's in topicals, it's in everything. How much of it is hype and how much of it is science?
Well, just in your question there, it's in everything. I think I've seen CBD embedded sports clothes and like CBD embedded bed sheets, and just, it is in everything. So there's so much hype, so much hype. CBD as a molecule is a really interesting molecule, and the way it works on the regulatory system, the endocannabinoid system that is in every mammal, that's what makes it interesting. And that's what kind of makes it difficult to dissect away from the hype, because the endocannabinoid system is such a powerful regulator in the body that if you just help it a little bit, a lot of things correct themselves on their own. So that, the tale of the snake oil where it works for everything, CBD for all. That's not how we approach it medically. But because endocannabinoid system is so powerful, and because it is literally on every cell and has some interface with most systems, even little things that you do like drugstore CBD, you're going to see something. It's more about, well, what toxins are in there? What heavy metals are in there? How did you extract it? Are you giving lead and mercury at the same time? And is that set of molecules, that molecular profile, actually appropriate for the case that we're treating? So yes, lots of hype, but it is a really amazing system to work on that from a practitioner's perspective is pretty easy. It's really, really easy to affect the ECS positively, even with some pretty simple products.
So if just for all the veterinarians listening out there, can you give us a very simple way to explain the difference between cannabis and hemp to an owner?
Absolutely. I use the term cannabis for speaking about the plant. That is its genus. So it is in the cannabis genus. And that means it includes all the different subtypes that are there as well. And so cannabis is just this very broad about the plant. And we can have two subtypes that are most common, hemp and marijuana. And the designation between them in the US, North America, and a lot of other countries, they'll have similar policies. It's about the amount of THC grown in that plant. So hemp has less than 0.3% THC. In the US, that's our dividing line. And marijuana plants have more than 0.3% THC. Now, importantly, the plant doesn't know that that's the rule. So there's a lot that goes on kind of in the background to make sure the plant grows into the specification that it's supposed to. But from the practitioner side, that's how we know the difference between the products. I'll pull that all to say we always want a certificate of analysis. No matter what the bag says or what the marketing person tells you, say you want the lab report to actually know which molecules are in the product.
True, false. You need at least a little bit of THC in the product for CBD to be absorbed.
False, although the synergy of those molecules can make that seem true. Those two molecules being together are not going to affect the absorption of each other. We do see these molecules be lipid soluble. So actually, more to that question is giving the product with a snack is going to affect the absorption more than which molecules are in them. But the molecules of the cannabis plant do have this beautiful synergistic effect. And so having them together can have a different, often more, but it could also be less clinical effect than we expected if we use individual ones. But we know this already, right? It's like giving a non-steroidal with an opioid. We know that we use multimodal practices across all of our areas of medicine. This is no different. And the body likes complexity, especially when you're working with a botanical. The more background micromolecules that are there, the better it does in the actual biologic being.
So asking for a friend, and this is a smart ass question, if I take the THC with a snack, will it keep me from wanting more snacks later on? Just kidding, I'm just joking. The problem I have with CBD though is that they are marketed as miracle cures. What's the biggest myth bust you have to do for veterinarians and especially owners?
One product does not fit all. The molecular profile, and what I mean by that is the ratio of CBD to THC, the terpene molecules that are in there, the minor cannabinoids, that's what's going to dictate whether this fits for your case. So it is having one product that you use for all cases is not going to work. However, I'll go back to a comment I said before. The ECS, endocannabinoid system, is amazing and so good at balancing that if you just guess and start the animal on something, you're probably going to see some benefit in like half your cases. And that's pretty good to know that you're going to get it half right most of the time. But if you really want to tailor that molecular protocol to the case, looking at which molecules you're using, looking at your COA, And journaling the effects is really the way that we as practitioners from that true medicine science side know what's going on.
When it comes to the labeling of CBD products,
Mm-hmm.
how much of it is actually true? Because at least here in Southern California, it's sold over the counter at old pet stores. How much of that is actually worth that $80 bottle?
I have seen some very, very expensive, very non-interesting products, like $200 for a bottle of a CBD isolate. So let's just talk about that terminology. That means that in that bottle, it's an isolate. So there's only CBD. Now, that molecule can come from any source. It doesn't tell you anything about the cleanliness of the product or any toxins that might be in it. But because it has a pretty paw print on it, a lot of companies will mark that up quite high. And I have seen some awful labels, some really misleading labels, some just poorly thought out labels. So you do need to read your labels really carefully, but I'll guide everyone back to the certificate of analysis that actually tells you it's free from heavy metals, free from pesticides, which molecules are in it. That's really what we need as practitioners. The label can be useful in some ways. It tells you about other, like what oil it's mixed in, that sort of thing. But we need to know the molecules so that we can actually judge how it's going to interact with the other drugs we're using, or be able to track its effect in the cases.
Are there any certain conditions where there's a ton of research where cannabis helps, and are there other conditions where the research is paper thin?
Yes, pain is a well-researched one. That's also an easy one to look at because pain responds really well to support from the ECS. Seizures has a lot of support behind it. That work is done mostly by CSU. Cornell has done a lot with the pain side. And there begins to be a lot of other types of cases that are being researched. But you know what's hard is it's still led by the product companies. And so it is, just as in other areas of medicine, hard to get some of that research money to look at the clinical applications that we actually need. For example, what do we know about using cannabis in renal failure cases? Now, clinically, we have a lot of information. Clinically, I know how to work with that, but I would really like to see some clinical research in this specific subset of patients. And we just don't really see that type of research happening. Our medical director, Dr. Guevara, is Brazilian, and he just recently finished his master's thesis in holistic medicine, in cannabis, and his research was on the effect of cannabis as a pre-anesthetic. And so how does cannabis affect our propofol dose? And even though that was a really simple look at just propofol, definitely demonstrates that the molecules on board our patient before we go into surgery affect our drug dosages and how our patients respond under anesthesia. So that was a really interesting one to truly start blurring that clinical use. We can't just think about it as like on the shelf, this supplement, we're not sure what's going to happen. It absolutely affects the drugs that we're using in our patient otherwise.
Well, that's true about almost every supplement out there. You don't know how,
Absolutely.
with the holistic patients, you don't know how they're going to interact at all.
Absolutely.
You don't know. Yeah, it gets kind of scary when people like would load their animals up with all these different supplements before their rabies vaccine to avoid rabies vaccinosis. And I'd be like, oh, we don't know what all these do, but okay, here's the rabies shot, and let me know if there's a problem. It is scary. It is scary when it comes to that. And so you bring up a bunch of questions for me. First one, what drug interactions do we have to worry about that are truly known between cannabis and, like, let's say, anticonvulsants, NSAIDs, things like that, heart medication?
I will reshape the question a little bit to say more caution. It's more important that we know there can be an interaction than that we don't use them together. For example, I can often use cannabis, hemp-based, marijuana-based, whatever fits for that patient. So I'm using cannabis in this bigger, larger term, in conjunction with a nonsteroidal and be able to lower the dose of my nonsteroidal because cannabis is having its own effect on the body. And so together, again, that synergistic effect, I'm able to have less of that pharmaceutical, more of a botanic support for the patient. So that's a drug-drug interaction, drug supplement interaction. If you don't know that, then you are probably giving your patient more of a non-steroidal dose than you need to. Now, we don't necessarily know that that's going to be negative. We know that from the non-steroidal side, and we think that cannabis is going to be supportive and help that patient not have some of the negative effects of the non-steroidal. But if as practitioners, we're not really conscious of that interaction, then we're not going to be tailoring all of our drug dosages to actually fit what's going into the patient. Does that make sense just as a concept? And then I can give you a few other
Right.
specifics that we should watch out for.
Right, because what I'm thinking of, like in people, it's like grapefruit and blood pressure
Mhm.
medication, right? It can really
Mhm.
exponentiate the effect, make you pass out. Are there effects like that we need to worry about?
Yes. Not quite that severe. And again, as practitioners, if we're just aware that they're there, often we can use them for our benefit. A really good example, though, is gabapentin. So gabapentin works on the calcium channels in that neuron, and the CB1 receptor, one of the endocannabinoid system receptors, also works quite heavily at that same area of the neuron. And so if we add cannabis to a patient that's already receiving probably that higher dose of gabapentin, maybe pain control, we will definitely see the increased effects of gabapentin. So you'll see ataxia, sedation. Most pet parents like the effects of cannabis better. And so that's easy, right? Just lower your gabapentin dose. Know that's what it's coming from. But as a practitioner, if we're not aware of that and suddenly our animal's staggering and ataxic and we're not sure why, that means that we don't really know what's going on. So that is an interaction that happens a lot, and we see that all the time. But that's not negative unless we don't know that it's there. Same thing for anti-seizure medications. We definitely see some form of interaction. Now, that's an interesting one because in the actual research studies, we don't see changes in the anti-seizure medication levels themselves. So if we do like a phenobarbital level, it doesn't seem to actually change if we use cannabis. That level will stay the same, but our need to use less becomes more possible. So there's something that's happening in the body that we're not quite sure about, and we're able to lower those anti-seizure meds a lot of the time, but it doesn't seem to actually change the level in the body. So what that means to me is we're missing something. There's something we don't know. There's something about these mechanisms we haven't quite figured out. And if there's anything that cannabis teaches you, it's humility. As a practitioner, it is a field where you have to always remember how fast it's going around you and how fast the science is coming out.
Yeah, it's evolving very quickly. It's like technology almost when it comes to cannabis. Um,
Absolutely.
one thing I read this morning was that gabapentin affects blood pressure levels in cats. Is that the same case with CBD supplements, hemp or cannabis? Will
Not that we
lower blood
have
pressure?
Not that we have some scientific research around. However, clinically, yes, because we're going to see anti-anxiety effects, better body effects, so less body sensitivity. So just from a handling perspective, that animal is going to be less stressed by supplementing the endocannabinoid system. So putting that, let's say, CBD into the body. One of the really powerful actions of CBD is to decrease the rate at which our own endocannabinoids are destroyed. So essentially, as that cat tries to self-soothe, to purr, to groom, to just take a breath, having some CBD in their body is going to help them do that better. So clinically, we will see that blood pressure go down, but that's the kind of research that we need, something that really looks at that unique patient experience and lets us as practitioners know, well, how much should we be using? What should we be doing? But clinically, we have a lot of evidence and know how to work with that pretty well.
What is the danger zone for THC or the ratio that we need to watch out for?
So THC, beautiful molecule, powerful molecule. The reason it is so powerful is because it has really strong agonist activity at some of these receptors in the body, particularly in the central nervous system, with dogs having a lot more of these receptors. So that's why they get some of their very interesting effects from too much THC. But importantly, I want to point out to all of our colleagues that a THC intoxication that we've all seen in the clinic, the poor miserable dog who's just standing there swaying, like just having an awful experience.
And getting
That's when
scared to
someone
death
gets
of any movement.
absolutely light
They
phobic,
freak out.
sound
Yeah.
phobic. Yeah, just like poor kiddo. Like, I'm so sorry. I'm so sorry for what you're going through. That's an animal that's gotten into someone's stash or the brownie. And we're more worried about the chocolate than the cannabis. But still, that experience with THC is really negative. And we've all seen that. When we're working with cannabis medically and we're using THC, we're always titrating up really slowly so the animal's body can get accustomed to it. And again, making sure that we're matching the molecular profile to the case. So just like if we give opioids to an animal that's actively painful, they're probably not going to be nauseous. But if we give pre-surgical opioids to a patient who's pretty healthy, they're going to be nauseous. So if we're matching our molecular profile well, we can work with pretty much anything, but it has to match that system. And I'll just throw in a safety note. The antidote to THC intoxication is the CBD molecule. So rather than us having to do all this interlipids and activated charcoal, really a really simple answer is to give that animal CBD, and the CBD molecule is going to change the conformation of the receptor, so THC can't bind as easily to it. So that high will come down, the animal can metabolize the THC, they can go home. Also, interestingly, if you zest a lemon in front of that animal's nose, the terpene limonene will also bring down that high. So we're learning a lot of safety in association with how to deal with THC intoxications.
Zest a lemon. Love that one. Gonna
Yeah.
do that.
Isn't that amazing?
I'm gonna try that one.
It's
Yeah, no, that
fascinating to watch. Like, you'll have this animal who's incredibly stoned, like just sawhorse swaying stance, and the limonene terpene is in the peel, so that's why you have to zest it. You will see them come out of that high. Now it's aerosolized, olfactory, so you
temporary.
have to keep doing it. So it's not as
Yeah.
prolonged, and you have to redose, and CBD you have to redose until that THC has been metabolized. But it's amazing to watch and so much easier than intravenous lipids. The animal can go home and everyone feels okay.
Well, so overdose in people is almost next to impossible with THC. Same with dogs, cats.
Well, intoxication is not hard to
I'm
achieve,
talking
right? That's just
morbidity, mortality.
yeah. So lethality, like the lethal dose, we don't really have that in animals, just like in humans. And particularly if it's a plant-based substance, you almost can't eat enough of it to do that harm. Now, on the extract side, you can kind of go into some scary levels there. But from a lethal perspective, no, cannabis is incredibly safe. Now, the animal might be very miserable, but that's why we know things about treating with CBD, treating with limonene. But from a lethal perspective, cannabis is incredibly, incredibly safe.
So asking for a friend, would zesting a lemon help with that poor
Absolutely.
edible high? Oh,
Absolutely.
there we go.
Yes. Yes. And even better would be to have some CBD isolate around, because remember the difference in your time. If you aerosolize something, you get a couple of minutes out of it. But if you ingest something, you're going to get 2 to 3 hours, and you can just keep repeating until that high is completely gone. But yes, it does work exactly the same for humans. So tell your friend that you now have a new bit of
Yeah,
safety.
I sure will. I sure will. What are the red flags on a label that veterinarians and owners should be cautious of?
Made up words. You would be shocked at how many labels I've read that just, that's not a word, that doesn't exist, that's not a thing. Claims are the other things you should watch out for. So if the bottle's making some pretty large claims, this will cure cancer, this will stop your dog's anxiety. I mean, that's really just common sense. There's no perfect treatment anywhere in medicine, so watch out for that. And then my personal word that I always look askance at is proprietary. So again, from that clinician's perspective, I want to know which molecules are going into my patient. So my team knows if we're evaluating a new product, someone reaches out and they're like, hey, I have this new thing, can you look at it? If there's the word proprietary anywhere on the website or on the product, it's not one that we're going to work with, because I don't know what's in it. I don't know how it was extracted. I don't know which molecules are there. And I do know the interactions that they have with my other herbal supplements, with my other modalities, acupuncture, any of that, and with any drugs that I might have on board. So for me, proprietary is one that gets a scratch off pretty fast.
So, when you talk about cannabis, hemp is legal here, not there. Marijuana is legal here, not there. In some states, we're allowed to talk about it, but we're not allowed to prescribe or recommend. How do veterinarians skate that fine line without getting in trouble?
Great question, because there's so much confusion around that. And again, we serve globally, and so we see policies of all kinds. Importantly, cannabis everywhere is very much a pet parent initiated treatment, right? We've said that pretty much throughout our entire discussion here. The pet parents are really driving this industry for the animals. And it's more likely that your animal has received a cannabis product and you don't know about it than they haven't, especially if you practice in Colorado like I have. So it's really important to approach all these conversations from a harm reduction perspective. That you as a practitioner need to know which molecules are in your patient. We know it's going to affect our drug dosages in general under anesthesia. So if we're not asking that question at check-in, if our team's not really checking history, putting it on our supplements list, then we're missing a really big part of our VCPR. There's a huge piece about our patient that we don't know. So framing it in a harm reduction perspective really puts all those other policies sort of out of range. We're talking about what's in my patient. I need to know before I prescribe something else what's actually in the body. So harm reduction focused, advising on what can match the owner's goals. Pet parents probably going to do something anyway, right? We know that. The owner is going to do what they're going to do.
Dr. Google, tell them what to do.
And there are plenty of Dr. Googles about cannabis. So it's going to happen. Can we give harm reduction information about don't have solvents in there, make sure you're testing for pesticides, heavy metals. So that's harm reduction education. And then if you are in an area or you feel comfortable working with the molecular profile, you can really match those to the case itself. And there's a lot of research to back that up. CBDA as a great anti-inflammatory, THC for good pain control. So there's a lot of ways to work with cannabis. You need to know the laws in your area. But the majority of time, these are not, it's more that it's silent on the veterinarian's perspective. We're just not included in policies. So approaching this from a harm reduction perspective of being there for our clients, like in the mud with them, roll up our sleeves, we're boots on ground. I think that's the best way to approach it. And for people who are not comfortable, our team can always assist with creating a molecular profile, helping the pet parent start it. And then the primary care DVM can do their job of assessing, doing blood work, doing those exams, and stay a little bit away from the cannabis side. So the options are myriad. Just knowing what you feel comfortable with and your clinic feels comfortable with is kind of the place to start.
Well, it's very important that you said something, and we're relying on the client to tell us that they're using that product. How many of them still feel shame in that product? And the reason why I say that is it's okay to go to a kid's birthday party and watch all the parents there get totally hammered, right, on booze. But if you want to go smoke a joint, you have to walk down the street because it's still a faux pas. Is there still that image that we have to deal with, that people are too embarrassed or too scared? Back in the day, people thought we were going to call the police on them. And how do you get around it? Or do you just, because you don't really know if an animal's on that product?
A great point. A couple of questions there that I'll answer. I think that stigma definitely exists, depending on which state you're in, which area of your state you're in, the tone or the culture of your clinic. You may even have a client who has had a negative conversation, maybe with a colleague or someone else on your team, and they're thus reluctant to talk to you about it. So the stigma definitely exists. However, I think that we're doing a much better job in general these days of doing really good history intakes, especially with our technicians really owning the responsibility of tell me everything that's in this animal. And they're so good at asking multiple times, asking multiple ways. And especially our veterinary cannabis counselors or veterinary cannabis guides through our certification program that really understand why this is important. I feel like we really can strengthen that intake. What the reception team knows what to ask, the intake team knows what to ask, the technicians are aware that this is important. And by creating that culture of inquiry and us being able to say, here's why it's important. This is going to affect the drugs that we're going to give during sedation. This is going to affect what the veterinarian might prescribe. It allows us to reframe that in more of a medical, scientific thought process rather than in the stigma. And I think our clients respond really well to that when we're just upfront with them saying, look, you and I, we're on the same page. We're doing this for the well-being of your animal. I need to know what's going on. And again, I'll reference in Colorado, we're dealing with a lot of psychedelic substances now. And for sure, the stigma exists there. So getting a client to tell us that they're growing psilocybin in their house, or that they're using LSD, or they have ayahuasca around. And those substances are much more dangerous than cannabis, but I think the same protocol applies, is that we have to be really honest about our emphasis on the animal's well-being and that we're not there to stigmatize, we're there to help.
Now, you talk a lot about PTSD in pets. How do you diagnose that and how do you define that?
In my career with the military, canine PTSD was a big piece of what I saw and interacted with, but also handler PTSD. And that was really where my interest in interspecies medicine, family unit medicine, cross species contagion really took root. How are we all affecting each other? And PTSD is this interesting condition that looks really, really similar in both humans and canines. And so from a research perspective or working with cases, what's really interesting is you can have a human and a dog that literally had the same incident that caused the injury. They could have gone through the same door, stepped in the same IED. So that just brings up some really interesting research questions. But the condition itself looks really similar. Difficult social bonding, difficult sleep patterns, hypervigilance, inability to settle, increased vocalizations. Like the symptoms, clinical signs look really similar across species. And I think it'd be really interesting for us to think about, can those protocols for healing that we're beginning to find on the human side also be applied to the animal side? And just before I toss it back to you for any comment, I'll say what I find interesting is how many behavioral health diseases I see spilling over into animals that really originated in the human. So thinking about that, how can the PTSD in the human be causing that in the animal? And maybe we need to shift our definition a little bit to really understand this complex of signs. What are your thoughts on that? What's your interface?
No, I like, because you brought up a whole different point. I wasn't thinking like PTSD. I could understand if a dog, and it's disgusting to even talk about, but let's say a dog was abused since it was a puppy.
Yeah.
That is definitely a dog that has signs of PTSD, because you could see that they lack trust, they lack respect for the human, especially if someone went to a shelter and adopted them or is fostering them. And how much does CBD products, marijuana products, cannabis products help with that? And is it a one-all fix-all? And does it take time to work? Are there times it doesn't work? I mean, because I would love to do anything, because I'm a huge fan of the underdog, right? And that's what I feel a lot of these animals are that are at shelters. They've been raised poorly. They've had horrible lives. They deserve the best. They deserve a second chance. So I'm into hearing anything and everything in order to help them as much as we can.
Absolutely. Manipulating and healing the endocannabinoid system, which really I would say is the majority of my clinical practice, is changing that ECS and figuring out how do we heal this system and make it work a little bit better in controlling the other subsystems. That's a really good way for us to look at any animal that's been traumatized, and shelter scenarios give us a unique way to think about that. In humans, we have some information on endocannabinoid system deficiency. So you can either have congenital deficiency, you don't have some of the receptors, you don't have some of the ligands, or you can also have acquired. So consistent stress over long periods of time require the body to keep settling itself. So the endocannabinoid system is essentially using up its resources to calm itself down over so many incidences. Does that make sense? Think about that shelter scenario. The kennel crazies is a term that you'll hear a lot from shelter workers, just the animal that really struggles in this environment that consistently has things that stimulate them. What we see from an endocannabinoid system perspective is that system's essentially fatigued. Maybe it is appropriate. Maybe they have all the receptors, but literally it's exhausted from having to settle itself over and over and over and over. And so from a practitioner perspective, if we can think about the endocannabinoid system and we can affect that and help that by things like massage, body work, change in diet, all these modalities affect the ECS. Cannabis is just this really clinically useful, accessible, safe way to also affect the ECS. So if we think about an animal that's been in a shelter, its endocannabinoid system is fatigued. It's so tired from having to settle itself after all the stimulation. Giving it a cannabis product, usually a CBD dominant product, is going to help that endocannabinoid system have enough resources to settle it down. And now this can be good just for maintaining a healthy animal in a shelter environment, but think about that social bonding. Particularly the first couple of weeks that they go to a new home, just helping them adjust to all of that new surroundings, that can be a really, really lovely place to put cannabis in.
You brought up an interesting point and made, light bulbs go off about allostatic load. And how much has the ECS system been studied in allostatic load? Do you have any idea, especially when it comes to military personnel?
I would ask our medical director offhand for some more specific, like what's the current research on that? It has been studied on the human side, not on the animal side. I would be very interested to see kind of what's out there right now, but I would definitely pass that question to our medical director for some of the more current stuff.
Yeah, the reason why I asked is because my dissertation is heavy in allostatic load, and I'm studying cortisol levels in stress veterinarians. That's one of the things I'm looking at for stress. And I'm wondering if we should look at the ECS system.
Absolutely. We definitely should
Sounds
be.
like a
Now, what's
postdoc.
hard about that? Yes, absolutely. What's hard though is we don't yet have ways to assess kennel side, the levels of endocannabinoid systems in the body. That's more at the research level, like a research institute. So there's just a little bit of lag between, I think, us being able to do that really well, really easily, but it's close. It's really, really close, I think, to have some of those tests kennel side, or at least be able to have some of that assessment.
Yeah, because I think it could help with a lot of our behavioral cases. Heaven forbid you do those behavioral euthanasias.
Absolutely. Absolutely. That's the majority of the cases that I see now are behavioral. Sometimes it's the animal, sometimes it's the human, sometimes there's interactions that are the hard part. But cannabis, because it's working on that endocannabinoid system and helping the body regulate itself, is a beautiful modality to use for behavior cases.
So when we first talked, you also started talking about psychedelics when we did a little meet and greet before this whole podcast. Where do you see psychedelics coming into veterinary medicine?
Well, I would say they are already in veterinary medicine. Just like cannabis, this is not a field that we have a choice about. The ERs are already seeing intoxications, and these molecules are often synthetic, which means that they can be extremely concentrated and have significant effects in the body. So, from veterinary medicine perspective, it's already here, and we are kind of already behind in terms of us knowing how to respond, because these medicines work very, very differently than cannabis or some of our other drugs, and the effects last much longer than that exposure time window. We actually see some opening of critical learning periods that can stay open for several weeks after the exposure. So it's not just about the intoxication phase, it's about what happens in that animal's neurologic circuitry after the fact. So psychedelic medicine, it's already here. We are already in the midst of it, which is kind of a crazy thought sometimes.
Is there any research being done right now for its use in veterinary medicine, or is it just on toxicology?
That's where our team is headed. So there are preclinical studies in dogs before some human trials on the PTSD side. We definitely have lab animals, so mice studies, and those are really informative. But we really need to be looking at clinical applications, how to respond to intoxications. And we're discussing with a few groups now what that looks like. There's some really negative things happening in psychedelic research to animals. It is an area of research that it's about hype. It's about who has the next new study. In fact, on the 26th, this Friday, we're holding a discussion group about what we feel is some very inappropriate animal research that's happening in psychedelics. So it's a ugly field at the moment. There's a lot happening in which we as professionals, we as colleagues really need to have a strong voice, because it's about money, it's about ego, it's about a lot of humans projecting our own healing journey onto animals. So there's a lot happening on the psychedelic field, but we definitely want to be the group that's projecting some best practices, some consent-based ways to do research. And I think that has to be at the forefront. What are the ethics and the consent basis of some of this research in animals?
Yeah, it's scary. You know, humans always seem to put what's going on in human medicine into their animals. I remember the whole gluten-free craze that went through like 2014, 15, 16, and all the grain-free diets that came out, right? They went from barely any to everything was grain-free. And then you had dogs keeling over dilated cardiomyopathy.
Absolutely. Absolutely. And in the psychedelic field, just like the cannabis field, they're not that dissimilar. What's concerning about the psychedelic field is how powerful the substances are and how they work. But what we see is everyone vying for the next patentable thing. And on the psychedelic side, different from cannabis, which is a botanical substance, on the psychedelic side, we have molecules like LSD, MDMA, that you can just tweak a little bit. And so we call them designer drugs. And it means that you can patent it and probably make a lot of money in this early field, but that does not mean it's safe or that we know how to handle it, or that we should be subjecting these animals that did not consent at all to this into some of these studies. So there's a lot of hard and unethical things going on at the moment. So anyway, please join us on Friday for more discussion, because there's a lot that we need to do as a community to really stand up for this.
I think it's very important to understand. Yeah, you know, some people talk psychedelics nowadays, you just think about mushrooms, right? But yes, there's a whole another side to psychedelics that are so hardcore, it's crazy. Well, let's talk about mushrooms. If you have a mushroom toxicity case come in, what do you do? Or is that also lethal, or do they tend to get over that pretty easily?
Great question. We are starting to publish some clinical briefs on our website, just like what to do. Do you induce emesis or not? How do you how do you take history for psychedelic intoxication? And there's just a lot that we as clinicians need to get up to speed on, because these molecules are different. But for psilocybin, which comes from a mushroom, that is more similar to THC in cannabis, in that it in itself is not going to kill the animal. So lethality wise, so from lethal perspective, psilocybin is pretty safe. Now, the animal's experience under that is a completely different thing. However, the synthetic molecules like LSD, MDMA, these can be really, really serious. Serotonin syndrome, overheating, and those you can see some really serious clinical consequences. Psilocybin is more going to be from the mental and behavioral effects on the animal. And what I tend to see in my practice is the animal that got into the stash. Just like cannabis, the humans left it out and the animal got into something, or the human's growing at home and the dog is curious. And so we worry about chocolate, xylitol, things that the psilocybin might be mixed in. That's really, really common. So concerns for that. Or what happens after the fact. And again, my practice tends to see the behavioral effects that come up when the animal found someone's stash and had an unguided experience, and now they have all these new behavioral health disorders. So there's a lot that happens both in the period of exposure, but then also in the weeks following, that we really need to be aware of, because it can make some very long-term health consequences that we don't really know how to identify yet.
In the near future, do you hope to see cannabis certified veterinary clinics?
We currently offer certifications to individuals, and I think that that really gets a lot of the harm reduction information into the place it needs to be in clinics. I think cannabis certified clinics might be a little bit hard because I think the practitioner is really where that cannabis knowledge fits. So having cannabis knowledgeable individuals within the practice, more like that individual who educates on the young puppy class, or here's my dental expert, or here's my nutrition expert. That's really where we feel that it's fitting. And those individuals, particularly our veterinary cannabis counselors, are technicians who have their medical background and then add this medical cannabis knowledge on top of it and can really counsel about drug-drug interactions, how to read a product label, how to read a COA, how to titrate. So rather than clinics, I think looking at individuals who have that knowledge that fit within holistic or integrative clinics probably is a model that it works really well now, and I think we'll kind of see continuing in the future.
Last question. If there was one thing you could wave your magic wand and change policy tomorrow for veterinary medicine, what would it be on the cannabis side?
Knowledge of the endocannabinoid system. Cannabis is cool because it works on the ECS, but there are a lot of other things that will as well. So if I had one thing to shift, it would be knowledge of ECS for us, for colleagues, for pet parents, but also how our policies are written to really think about that biologic system, which is affected by this plant, but that's really what needs to be manipulated at a clinical level and needs to be guarded from a policy level.
Well, that sounds, yeah, wow, that would be amazing. Maybe they could teach some more soft skills in veterinary school and also the ECS system
Absolutely.
in that 5-credit neurology class I had to take at Illinois. Well, Dr. Andre, thank you so much for your time. Now, you have a class coming up, correct?
Yes. So
In
we are
October?
starting our October class. Yes, we start on October 3rd, and we are still taking applicants if anyone's interested in joining. It is our veterinary cannabis, veterinary guide, and cannabis knowledgeable veterinarian certification class. It is 3 months, 6 classroom webinars, and a lot of self-paced content. Really, really fun class to teach. We have students from all over the world join. Right now, we're only able to serve English speakers, but we're working hard to make Spanish available, and hopefully would have like French available soon. So if anyone's interested in furthering their knowledge, we hope you come and learn with us. It'd be great to see you in class.
And if they're very interested in getting a hold of you, what website should they go to?
Veterinarycannabis.org is where you can find us at any time. And our email is reception.desk@veterinarycannabis.org. Feel free to reach out. We'd love to connect with resources, help with consults. We have a shadowing program for either colleagues that want to watch us work on cases. Sometimes that's a good way to get your feet wet, to shadow our clinicians and shadow our VCCs, as well as our cannabis classes. There's a forum that you can join. So lots of community conversation around cannabis, which is important for any emerging modality, for us to share information